Many of us end up with mouth ulcers at some point in our lives. So, in today's video, we will look at the possible causes for ulcers and what we could do at home to manage them effectively. Now, an ulcer is a breach in the superficial lining of oral tissues. Now, these ulcers can either be solitary or they can appear in clusters. The most common type of ulcer is the small solitary ulcer, which is the size of the top of a pencil. Very large ulcers are rare, and if they occur, they take quite a long time to heal. Ulcers can be divided into three categories. The first one is an acute ulcer, second one is a chronic ulcer or recurrent ulcers. Now, acute ulcers are those that last for less than 2 weeks. Chronic ulcers last for more than 2 weeks. And recurrent ulcers are those ulcers that heal and then tend to recur frequently. The frequency of recurrence is based on certain trigger factors. So, why do ulcers occur? One of the most common reasons is trauma. Trauma could be due to cheek or tongue biting, or it could be due to a sharp filling or sharp edge of a tooth, or it could be if you're using a very hard bristled toothbrush, ill fitting dentures, braces, etc. So, anything that's irritating your oral mucosa can cause ulcers. Cause number two is hormonal fluctuation. Women in particular experience quite a lot of hormonal changes at various times in their lives. Some women develop oral ulcers just a few days before their period. If you think your ulcers are recurring, then it's advisable to check if they are occurring roughly around the same time every month. If this is the case, then this could be due to hormonal fluctuations that are taking place within the body. Cause number three is stress or anxiety. Now, often we see patients with ulcers during periods of stress. Now, I have a relative who always ends up with ulcers when she has an exam. Now, we usually see a direct correlation between stress and ulcers, but the exact mechanism of how stress causes ulcers is not clearly understood. Now, it could be that there is a change in oral habits during periods of stress, so such as cheek biting or tongue catching or grinding your teeth. It also could be due to issues with your immunity or your body's defense mechanism. So, when you're stressed, your body's defense against germs such as bacteria or viruses is slightly lower than normal. Now, this increases your chance to develop oral issues such as ulcers. Cause number four is medications. Now, certain medications such as ibuprofen, alendronate, nicorandil can have certain side effects like ulcers. So, the moment you discontinue the use of these medications, the ulcers also will stop occurring. So, if that is the case, you may want to see your doctor to see if an alternate drug can be prescribed for your condition. Cause number five is nutritional deficiencies. And this includes iron deficiency, folate deficiency, vitamin B12, and even calcium deficiencies. Now, they could manifest as oral ulcers or even cracks near the corners of the mouth. Now, kids in particular need more amount of vitamins compared to adults. This is just because of growth and development. And it's quite common to see ulcers in kids if they've got vitamin B12 deficiency. So, a well balanced diet is very important to keep ulcers at bay. Cause number six is infections. Now, certain systemic infections can lead to ulcers not only in the mouth but also in other parts of the body. Some of the examples are tuberculosis, syphilis, diphtheria, herpes, hand, foot, and mouth disease, chickenpox, scarlet fever, etc. Cause number seven is allergy. Now, if you're allergic to certain materials, then you could develop an allergic reaction exactly at the site where the allergen contacts the skin. Now, common allergens are poison ivy, leather, rubber, nickel, mouthwashes, amalgam, denture powder, or even certain drugs. The allergic reaction usually disappears when the allergen is removed. So, say if you're allergic to amalgam, that is the silver filling in your mouth, then once that silver filling is removed and replaced with a different type of filling, then the allergic reaction will also disappear. Cause number 8 is ulcers associated with malignancy or cancer. Now, this is usually seen if the ulcer is long standing and non healing. Okay, now let's look into the treatment or management of ulcers. The good news is that most ulcers heal by themselves, and this takes roughly 1 to 3 weeks to heal. Now, the main thing to do is to find what is causing these ulcers, because once we treat the cause, then we can prevent these ulcers from occurring. Ulcers can be quite painful and can hamper day to day activities. So, to make the ulcer more tolerable, there are a few options. Now, all options will not work for everybody. You need to find what option works for you best. Now, option number 1 is to use an ulcer protective. These are gels that are readily available in pharmacies. They are over the counter drugs, so they do not need a special prescription. These ulcer protectives usually have a topical analgesic, that is a painkiller in it, that will also help soothe the area. The main component is something known as carmellose gelatin, which protects the ulcer from the oral environment. Option number 2 is a home remedy. For this, you could use 1 tablespoon of thick yogurt, add half a teaspoon of turmeric to it, mix well, apply this paste onto the ulcer. Do this about 3 or 4 times every day, and make sure that you apply this paste after your meals. It's also advisable to consume a lot of yogurt in your diet. Now, yogurt helps in balancing the pH of the area, and turmeric is antibacterial in nature, so prevents further infection of the ulcer. Option number 3 is to use orthodontic wax. Now, this is easily available, and it's a long stick of clear wax that you can easily break off. Use this if the ulcer is due to anything sharp in the mouth, such as braces or a broken filling or a broken tooth. So pinch off a small piece of wax and then apply it onto the point of irritation. You may want to see your dentist to sort out the issue if it's a sharp filling or a sharp tooth. Number 4, keep the area clean, avoid spicy food and foods that are too hot or too cold. Now, to maintain regular oral hygiene might be slightly difficult. It's advisable to use a mouthwash after every meal and also use a soft bristle toothbrush. Number 5 is to maintain a good diet. Make sure your diet comprises of a lot of green leafy vegetables and is rich in vitamin B12, iron, folates, etc. Now, if you're anemic, it's best to see your doctor to get a blood test done. Option number 6 is to rinse your mouth with warm salt water 2 to 3 times a day. This prevents further infection of the ulcerated area, and that also helps the area heal faster. In some people, the ulcers take longer than usual to heal. Let's look at the factors which delay healing. Number 1 is smoking. Now, when a person smokes, this causes further irritation to the ulcerated area, hence taking it longer to heal. Number 2 is a poor diet. If you're suffering from nutritional deficiency and are continuously eating a poorly balanced diet, then your body is not getting the nutrients it needs for healing. Number 3 is poor immunity. So if you're suffering from systemic conditions and you're suffering from poor immunity, then this can delay healing. This is basically because your defense mechanism is compromised. Number 4 is chronic stress. Now, chronic stress can affect your immunity, which in turn affects healing. So, when to see your dentist? Now, if you've got a persistent ulcer which hasn't healed in 3 weeks' time, then it's best to see your dentist as soon as possible. Your dentist may want to take a biopsy and send it to the lab to see what it might be. The next scenario is if you have a very large ulcer. If your ulcer is larger than the size of a pencil top, then it's best to get the area assessed by a dentist. Now, if your ulcer has other symptoms along with it, such as fever, tiredness, or a rash all over the body, then you may want to see your physician at the earliest. If the ulcers are spreading or they're occurring in other parts of the body, then you may have to see your doctor as soon as possible. Also, if the cause of the ulcer is due to something sharp in the mouth or something that's irritating your oral tissue, such as a sharp filling or broken denture or a broken filling, then you will have to see a dentist to get that sorted. So, hope you found this video useful. Thanks for watching and see you soon in the next video.